Vancouver Coastal Health, promoting wellness, ensuring care.
Dramatic news stories happen all the time, and we see these people in our ICU. People are well one day and then they're not. They're in a ski accident, they're in a car accident, they're in an explosion. Like, these things do happen. So it's not just for those with chronic illness. I really think this is somebody that everybody should be discussing, because if I end up in the ICU and my husband has to speak for me, then I want him to know exactly what care I want and what I feel quality of life is. Last Easter, I brought advanced care planning to family dinner. So extended family, all my aunts, all my uncles, and I sat them down and I was like, before you have dessert, we're going to talk about advanced care planning. And I think everybody rolled their eyes and said, "Oh my God, Jen, you're so dramatic. It's because you're an ICU nurse, you're so traumatized." And so, you know, people do sometimes think that I'm a little bit crazy, but at the same time, these discussions are important and these conversations are relevant. And, you know, it did get everybody talking about, you know, what does give life meaning and what would I want? And so, you know, the cousins do know what their parents want, which is really important. And you know, it's reflected when, you know, my aunt was admitted into the hospital just a couple weeks ago, and we can come back to the conversation and say, remember that conversation that we had? If something were to happen, has anything changed? You know, what do you still have the same thoughts about quality of life and what you would want to be done if you couldn't speak for yourself? If anybody wants to do advanced care planning, I would recommend that they go on to the internet, just Google My Voice Workbook, BC, or the VCH site. If you just search ACP, you can also get resources there. Basically, the My Voice Workbook will walk you through exactly what advanced care planning is, and if you want to fill out any documents, then you can fill those out in the second half of the book.